Good morning everyone. Today we are here to discuss about urinary tract infection. It is most commonly called as UTI. We have Dr. Vijay Sinha with us, Director Nephrology and Kidney Transplant here at JP Hospital. Good morning, sir.
Good morning.
So, sir, what is UTI?
See, UTI, as you know, we call it as urinary tract infection, is the infection of bladder, which is called as cystitis, urethra, which is called as urethritis, ureter, which is called as ureteritis, and kidney, which is called as pyelonephritis. So, it can involve from the lower tract to the upper tract, and this entire infection either caused by the bacteria or some other fungus or tuberculosis or anything else like viruses, then they are come under the gambit of urinary tract infection.
Right. So, sir, what are the different types of urinary tract infection?
As I mentioned, urinary tract infection can be divided into either upper urinary tract infection, which is called as the pyelonephritis, or a lower tract infection, which is called as most commonly as cystitis.
Right.
It can also be called as complicated UTI or simple UTI. When do we call it as complicated UTI? When there is a obstruction or anatomical disturbance of the kidney or the lower tract, then we call it as complicated UTI.
Right. So, sir, what is the most common age group which get affected with the UTI?
See, the most common age group which present to the clinicians is young females, who tends to happen a lot of UTI complications. Apart from that, elderly male, especially those with prostatism or bladder outflow obstruction, they tend to present a lot with UTI. And small children, sometimes those who have got mostly male child where there is a posterior urethral wall or there is anatomical disturbance of the lower tract, they present as most commonly as UTI.
Right. And what are the most common risk factors associated with the UTI, sir?
See, I told you anatomical disturbances of the urinary tract, be it a stricture, be it a posterior urethral wall, be it a prostate, or whether there is a stone formation, diabetics.
Right.
Female who are very much sexually active, not taking enough precautions, and somebody who has got a anatomical secondary to maybe some spinal tract injury or bedridden patients or those who are on catheter, they tend to have more UTI infections. These are the risk factors for UTI.
And how can one identify about their own?
See, for a common person who is developing an urinary tract infection, the symptoms are mostly fever, decreased appetite. There can be symptoms related to the urinary tract like frequency, urgency, multiple time going to the urination, polyuria. So these are the common symptoms, or dysuria, burning sensation during the micturition. These are the common symptoms which basically points toward patient having a urinary tract infection. If the patient has got these symptoms, then they should immediately consult a doctor.
Okay. And sir, what is the treatment for UTI?
See, the treatment for UTI is for a simple UTI is very simple in the medical practice.
Right.
We identify the problem by going for a urinary examination, maybe a urine routine examination and a urine culture, and we preemptively start with some medications which maybe quinolones antibiotic or some other antibiotics like nitrofurantoin or cotrimoxazole or fosfomycin, which are given simply oral treatment. If the patient has got a complicated UTI, then they may require intravenous antibiotics as well as correction of the anatomical problem. Because when we correct the anatomical problem, then only the recurrence of UTI is prevented. Otherwise, the patient, even if after the treatment, they will go on having recurrent UTIs.
Okay. And how can we prevent the infection from occur?
See, the first thing that we have to do is any child or any female or any elderly male has got any kind of urinary tract anatomical disturbances, that has to be taken care of. Whether it is by medical measure, whether it is by surgical measure, one has to correct it. If somebody has got a stone, then the stone has to be treated. They have to be taken out either by laser surgery or open surgery or by medications. If there is a prosthetic issue, then that area has to be treated surgically, maybe by a laser surgery. If there is any uterine prolapse, especially in the elderly female, or there can be a pelvic floor deficiency, sometimes the diabetics, those who are having a recurrent UTI, we have to very well control the diabetes, otherwise they will go on having recurrent UTI. While female having multiple sexual partners, it should be advised that they must take some preventive measures.
Right.
Male having such kind of relationship should also have local hygiene maintenance. So
Right.
these things can actually prevent recurrence of UTIs.
Sir, thank you so much for this wonderful session. We really appreciate whatever information you have shared. It is really helpful for our viewers. Thank you, sir.
Thank you so much. Thank you, everyone.